Believe it or not, right now, inside your own stomach, there's a high-stakes civil war going on. It's this constant, delicate dance between some seriously powerful corrosive forces and an absolutely incredible defense system. So today, we're going to take a look at the front lines of this internal conflict.
Okay, so to really get what's happening in this war, you first have to appreciate the fortress itself. And get this, your stomach is a marvel of self-preservation. I mean, it literally rebuilds its own protective wall every 3 to 4 days. Why? To keep from digesting itself. Just think about that for a second. That is an actual superpower, a feat of regeneration, happening inside you as we speak. And this really brings us to the central theme of this whole story. It's all about this constant, really delicate balance. On one side, you've got these aggressive forces trying to break down tissue, and on the other, you have these defensive mechanisms just working around the clock to protect it.
So when you hear the term peptic ulcer disease, it's not some big mysterious thing. At its core, it's really just what happens when that delicate balance we talked about gets broken. You know, when the aggressive factors get a little too strong, or maybe the defensive side gets a bit weak. Well, the scales tip, and bam, the stomach's defenses are breached. All right, let's meet the players in this war. On the attack team, the aggressive side, you've got gastric acid and pepsin. These two are the dynamic duo responsible for digesting your food. And then on the defense team, it's this amazing multi-layered system. You've got a thick mucus barrier, these protective chemicals called prostaglandins that help keep the stomach wall strong. And of course, that super fast cell regeneration we just talked about. Okay, so the battle lines are drawn. Now, let's take a look at what actually happens when that defensive wall finally gets breached.
Yeah, and we need to be clear here. An ulcer isn't just a little scrape. No way. It's a deep wound. We're talking about a break that goes past the protective surface lining and right down into the muscle layer underneath. It's a pretty significant breach in that fortress wall, and it's caused by the stomach's own powerful acid.
Okay, so this is where we put on our detective hats. If the system is so well balanced, what goes wrong? What breaks the truce and lets the attackers win? Well, it almost always comes down to two main culprits.
So, suspect number 1 is this incredibly tough bacterium called Helicobacter pylori, or H. pylori for short. This thing can actually survive in the crazy harsh acid of the stomach. And suspect number 2? It's a super common class of pain meds called NSAIDs. You know them, things like aspirin and ibuprofen.
And what's fascinating is how different their strategies are. H. pylori? It's all offense. It basically sets up camp in your stomach lining, causes a bunch of inflammation, and then, get this, it actually tells the stomach to produce even more acid. NSAIDs, on the other hand, they're all about sabotage. They go after the defense system. They weaken it by blocking the production of those protective chemicals, which basically thins out the fortress walls, making them easier to break through.
So, when this internal battle starts to go south, your body doesn't just stay quiet. It sends out signals for help. Think of them like clues from the battlefield. So let's take a look at what to listen for.
Now, a huge factor in the kind of symptoms you might feel is location, like in real estate. Ulcers usually pop up in one of two main places: a gastric ulcer, which is right in the stomach itself, or a duodenal ulcer, which is just a little bit past the stomach in the first part of the small intestine. And trust me, as you're about to see, that location changes everything.
Okay, and this right here is a classic clue for doctors. If you have a gastric ulcer, the one in the stomach, eating usually makes the pain worse. It makes sense, right? Food and more acid come in and irritate the wound. That can make people afraid to eat and they might lose weight. But with a duodenal ulcer, the one after the stomach, food can actually make the pain feel better for a little while. So some people might even gain weight. It's a totally opposite reaction, and it's a super important clue.
And look, ignoring these signals is a really, really bad idea. An untreated ulcer is not just about dealing with pain. It can lead to some seriously dangerous complications. We're talking about major bleeding, or even something called perforation. That's where the ulcer literally burns a hole straight through the stomach wall. And that, my friends, is a life-threatening emergency.
So how do we stop this war and bring peace back to the stomach? Well, the good news is modern medicine is actually incredibly good at doing just that.
The first step is to get a clear look at the battlefield. The gold standard, the best tool we have, is something called an upper GI endoscopy. It's basically a tiny camera that gives doctors a direct, live view of the ulcer.
While they're in there, they'll also test to see if that H. pylori bacteria is present, and they might take a tiny tissue sample, that's a biopsy, just to be absolutely sure what's going on.
And if it turns out H. pylori is the bad guy, the battle plan is pretty straightforward. It's often called triple therapy, and it's a three-pronged attack. Step 1 is a powerful drug called a proton pump inhibitor, or PPI, that basically just shuts down the stomach's acid factories. Then that's followed by a 1-2 punch of 2 different antibiotics to completely wipe out the bacteria.
But, winning the war isn't just about attacking the enemy. You also have to rebuild your own defenses. And that means getting rid of the things that weaken the stomach wall in the first place. So, stopping NSAIDs if you can, cutting back on smoking and alcohol, trying to manage stress. All of these things, combined with the acid-suppressing medicine, give the stomach lining the break it needs to heal up and rebuild that fortress wall stronger than before.
When you think about it, this whole story of the stomach civil war is a powerful reminder, isn't it? Our bodies are constantly sending out signals when something's not right. So the question I want to leave you with is this. Your body is talking to you all the time. The real question is, are you listening?